So in this regard, we all know that achieving complete responses or very good partial response are important. We know that the destination is important, but what I wanted to know is whether the road you take to get there also has some influence. And what we found is that the rate at which the monoclonal component decreases, because we only did it on patients with measurable M components, if the rate at which the M component decrease has any significance or not, or any relation or not with PFS and OS. And we did find that there were mainly two types of patients, those that we consider to have a sensitive kinetic and those that we consider to have a refractory kinetic. So they have, for example, patients that reduce the M component very fast tend to relapse faster also. But patients where you could get a bit nervous sometimes because you see that they start reducing their M component slowly and they perhaps achieve their best response after 4 or 5 cycles, those actually tend to be good kinetics in these patients. So this helps us not to be too worried when we find patients that are steadily slow in their M component, and we can get there more safely to transplant. And this was done in transplant-eligible patients. Our next step would be to perhaps evaluate this in transplant-ineligible patients, where we would like to offer them finite treatments instead of indefinite treatments.